Um, Hi friends, today I would like to show you a CT scan and something new like a 3D print of a patient who is suffering from a unique condition. He is a case of rheumatic heart disease who had undergone double valve replacement, aortic valve and mitral valve way back in 2006. He developed a paravalvular leak within 2 to 3 months of the operation, but it was managed conservatively for a very long time. Of late, he has developed new symptoms of breathlessness on mild exertion and weight loss. The CT scan was done to analyze the paravalvular leak this time, and we found something unique. If you look at the CT scan of this patient, this is the paravalvular leak. Now, if you look at this, all the CT vendors, all the CT people will give you images like this, and then you will try to measure something like this. That should I measure here? Should I measure here? Where should I measure? Or if you go to 2D images, you just do not know at which plane this defect is. So if I go like this and I crop like this, I'm cropping it towards the aorta and try to look at it. I'm at a loss to tell where the leak is and where should I sign it. If I crop from this end, you will see that there is a huge defect, but it is too huge. And should I close it or not? What should be the sizing of it? Where should I? So where should I measure it? Let us measure it at different levels. At this level, it is 8 mm, and if I crop it like this at different levels, I will get different measures. So I'm at a loss at what point should I measure it. Similarly, for the paravalvular leak, it is oblique and I have no idea how to measure it. Many people would go for balloon sizing in these cases. I think a unique thing that we can do, a simple thing that we can do is use 3D print. So this is the 3D print of the same patient, and this is his aortic valve. I hope it is seen clearly. This is his aortic valve. This is the housing of the aortic valve. There is no leak here. This is the right coronary cusp and there is a leak here. So this is the leak. So if you see the leak like this, it is here and it is opening in the RVOT. This is the point where it is opening. And if I go like this is a 7 French catheter and I'll go from this and try to close it. This is completely closing it. So this would be like around 6-7 mm. So 10 mm device would be very easily able to close this. So we know by putting a dilator here to size this defect like a balloon sizing, and then using the device based on the size of this defect. And similarly, the paravalvular leak is here. You see this? This is the location of the paravalvular leak. I'll just push the sheath through it. As you can see, the sheath is pushed with difficulty here because it is standing here on the opposite side of the aortic valve. So there will be difficulty in crossing this leak also. That is also understood by doing a 3D printing, because this leak goes very easy to go inside. But we will have to give bend to the catheter, use a JR and look posteriorly to go into the paravalvular leak. And you see that it is an oblong defect here, and it is very difficult to size it. But overall, if we see this, it is also this is almost completely occluding it with small space around it. So maybe if this is 6-7, we take a 12 mm device, it will be completely able to close it. In fact, if we have a balloon, we can size it outside the body. And then many people have a problem with sizing inside the body with a paravalvular leak because it may dislodge the valve. It may increase the leak. So sizing it would be much easier outside the body with this kind of a 3D printable model. That's the whole point of this small session with you. Thank you.